Hello, I'm Courtney Williams, and I'll be talking about Bordetella pertussis, the bacteria that causes those awful sounds you just heard, also known as whooping cough. The whooping cough bacteria is spread from person to person in airborne droplets or by direct contact with infected throat or nasal discharges, and it affects the upper respiratory system, which consists of the nostrils, nasal cavity, mouth, throat, and voice box, or larynx and pharynx. And if not treated properly or quickly enough, it can spread to the remainder of the respiratory system. Coughing and sneezing are the most common modes of transmission of the disease, which is characterized by a severe hacking cough with breaks of high-pitched sound indicating a struggle to breathe. From a microanatomical perspective, pertussis are small, gram-negative, encapsulated, non-motile cocci bacilli with outer pili. From the perspective of the disease, however, whooping cough exists in three stages. The runny nose stage, which typically lasts for 1 to 2 weeks and is accompanied by a low-grade fever, which can be treated by antibiotics. The second stage, which you just heard, the paroxysmal stage, which can last from 1 to 10 weeks, is characterized by long, intense coughing fits. And the convalescent stage, which can last for weeks or months, is characterized by a chronic cough that becomes less sudden in its outbursts, but is a continuation of the paroxysmal stage at a lower scale. This disease can have severe complications, such as the onset of pneumonia, dyspnea or apnea, which is difficulty or stopping breathing altogether, dehydration or weight loss from the difficulty feeding, this is usually in children, seizures, brain damage, and areas of damaged lung, to name a few. There are several home remedies for whooping cough, including ginger for its antibacterial properties, raw honey for its throat soothing and reduction of mucus secretion abilities, and probiotics. But of course, anyone suspecting that they or their child has whooping cough should consult their doctor. Pertussis is especially fatal to babies and young children, acting as the leading cause of mortality in infants before vaccinations were synthesized, and so it should be prevented by vaccination with the DTaP vaccine at an early age. Vaccinations are also available for preteens through adults in the form of the Tdap vaccination, but are most recommended in babies and pregnant women. Treatment of pertussis, if it is not prevented, is usually done through antibiotics because the pathogen is a bacterium. However, if the disease is not caught and treated early enough, it will not slow progression and may still be fatal. In any case, since the emergence of the vaccine in the early 1900s, the incidence of whooping cough has been very low and quickly contained, excluding a large outbreak of the contagious disease in Wisconsin in the mid-1900s and another peak for the United States in 2012. For the most part, developed countries don't see nearly as much fatality from whooping cough as in the past, but there are still many cases that go undiagnosed and unreported, so it is important to keep up to date with vaccinations. Thank you.